This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right. Members of the jury, thanks for your patience. We were able to deal with that issue. And so we're going to return now to the cross-examination. We're still going to take a morning break, as I've told you before. It might just be a little bit affected by the fact that we just took that you took that break. We didn't take that break. So with that, we're going to return to the cross-examination. Mr. Reddington.
Sergeant Lawler, we're at the point where you are assisting, if you will, in the custody of Lindsay at Brigham and Women's Hospital when you observed a doctor enter into that area and ultimately into her room. Is that correct?
Yes.
All right. And the door was either closed or open or halfway, you don't recall, which is understandable, but you just don't remember if it was closed completely or open a little bit, right?
Correct.
But either way, you weren't eavesdropping or trying to hear anything, were you?
No.
And then when the doctor finished talking with Lindsay, at some point, you as investigators were aware that the doctor had allowed her to call her husband and use his cell phone to speak to her husband, correct?
I later learned that, yes.
And you later learned and knew from the investigation that it was fairly recently to that point that the tubes had been removed from her mouth and she was able to at least talk to a degree, and then she talked on the phone, correct?
Correct.
And after that, fair to say that you did not, when I say you, I mean collectively, all the police officers investigating for the DA's office, you did not see any reports or anything that would indicate what, if anything, was said between Dr. Zeisel and Lindsay in that room, right?
Correct.
And who is Sergeant, is it McElligan?
Sergeant McElligan, yes, sir.
And Sergeant McElligan, Joshua,
Yes.
he's the lead investigator in this case, is that correct?
Correct.
And at the time, he was a sergeant and you were a trooper, right?
At the time, we were both troopers.
Oh, both troopers. Okay, so you both got promoted. And he, as the lead investigator, told you in a conversation, or perhaps more than one, that the government theory is that Dr. Zeisel told Lindsay to say to her husband that she heard voices, right?
Yeah, if you could rephrase that.
Okay. Did you talk to McElligan about the theory that Dr. Zeisel is the reason that she told her husband that she heard voices?
Yes.
And do you remember where or when that conversation occurred, or how many times that you guys discussed that?
I believe it would have been at the office. I don't recall exactly when.
Okay. And there's no investigator basis for that. That's McElligan's speculation. Is that correct?
Correct.
When you went there and you observed Lindsay after the doctor left, she's still obviously in the bed because she's paralyzed, right?
Correct. You're still in the bed.
Was she restrained by either soft restraints or handcuffs or whatever? Do you remember whether her hands or her wrists restrained to the bedpost?
I don't recall specifically restraints.
Okay. And you mentioned that the state police were there. That would be people that were obviously working with you, right?
Correct.
And do you remember how many state police were there that you were coordinating or assisting?
Per shift, there was 2 of us.
2?
Yes, sir.
Okay. And also there were sheriffs from the Plymouth County Sheriff's Department that were there, right?
So we relieved the sheriffs.
Okay. And how many sheriffs did you relieve?
I don't recall exactly. Probably 2, though.
Okay. And how about Duxbury Police? You recall the Duxbury Police being there?
I do not recall Duxbury Police there.
How about the security cops for the hospital? Do you recall them being there, either in the room or outside the room?
I don't recall them being outside the room.
Do you recall coordinating with the security boss, the head guy for the hospital security?
I recall having some assistance at some point from security to get up there.
Okay. And do you remember how many days it was that you were assisting in the custody situation of Lindsay before she was allowed to have family and me and different people visit with her?
I don't recall exactly how many days.
About a week maybe, or less, or longer?
Less than a week?
Less than a week?
I think, yeah. I don't remember exactly, though.
And even though she was allowed to have visitors, still the police presence was there. Is that correct?
After I left, I'm not sure after I left what the visitation was like.
So when you say after you left, you mean when you left the hospital? You mean after you were finished with your tasked duty of dealing with her security and being under arrest?
Correct. After my assigned shift, I don't.
So after you were involved, obviously you don't know what happened after that.
Correct.
Okay. That's all I have. Thank you, sir.
Thanks, sir.
Redirect, Ms. Buckingham.
Sergeant Lawler, in your experience working in the detectives unit as a trooper, is it fair to say you oftentimes will have conversations as investigations are unfolding with other investigators that you're working on a case with about the case, potential evidence, theories of the case?
Yes.
And it's also fair to say that theories change over time based on your investigation and what evidence you find?
Correct.
Was there anything about a conversation that you had with Trooper McGilligan about this theory that affects your testimony as you stand here today?
No.
And you didn't hear anything that occurred in that room that day that you were there when Dr. Zeisel was there, did you?
I did not hear anything.
Nothing further.
Briefly, well, your testimony, basically, unobjected to, is talking about clothes that were seized at the house and the other investigation going to the hospitals. That's it, right?
Objection beyond the scope.
Sustained. All right. All right, anything further? All right, thank you, sir.
Thank you, Your Honor.
Thank you.
The Commonwealth would call Latiesha Dukes as its next witness, please.
Good morning. Do you solemnly swear that the testimony you give in jury shall be the truth, the whole truth, and nothing but the truth? You may have a seat.
Good morning. Good morning. All right. I'm going to ask you to keep your voice up and speak into that microphone, okay?
Sure.
All right, thank you. Yes, counsel.
Thank you. Could you please tell the jury your first and last name?
My name is Latiesha Dukes.
And how do you spell your first name?
Latiesha.
And how do you spell Dukes?
Dukes.
What do you do for work?
So I'm a licensed mental health counselor. I worked as a perinatal clinician at South Shore Hospital.
And what kind of education did you receive in order to do that?
So I have a bachelor's in psychology, a master's in mental health counseling, and a master's of education in mental health counseling.
And you mentioned the South Shore Perinatal Clinic. Do you still work there?
No, I do not currently still work there.
How long did you work there?
I worked there for about 5 years.
What did you do there?
At the perinatal clinic, I worked as a perinatal clinician, which involves like short-term therapy from prior to birth to postpartum, and supported with connection to care, whether that be therapy or higher levels of care, so intensive outpatient therapy, partial hospitalization, or inpatient care.
And do you often collaborate with patients and other clinicians at the clinic or nurses about treatment plans for patients?
Yes.
And do you help to manage the treatment plans with the patient?
Yes.
How do patients, or strike that, for your role at the clinic, doing the therapy and being the clinician, are you often referred patients by the nurse practitioners or somebody else who had seen the patient or did an intake with the patient?
Yes.
And do you work with that prescriber or practitioner over the course of the treatment with that patient?
Yes.
And as far as your role and what you do with patients, is it fair to say that a large amount of your ability to work with the patient is based on your relationship and rapport that you develop with the patient?
Yes.
And do you rely heavily on things that they report to you when you're assessing them diagnostically and trying to help them come up with a treatment plan and offering therapy?
Yes.
And one of the things that might be important in that is to assess a patient's presentation each and every time you meet with them, right?
Yes.
So do you do that in each appointment or each interaction with a patient, assess them for various things?
Yes.
And what kinds of assessments do you perform?
So I typically perform a psychosocial assessment, which is getting their behavioral health history, as well as their current presentation and reason for coming in for therapy. So whether that be a specific diagnosis or current concern, or recent like crisis or trauma, and also a risk assessment that assesses how they're doing in that moment.
Okay. And as far as the therapy component of your interactions, is that largely based on the patient?
Yes.
And what kinds of therapy can you offer in that short-term therapy?
In that short-term therapy, we offer cognitive behavioral therapy, dialectical behavioral therapy. I also offer something called EMDR, eye movement desensitization and reprocessing therapy for patients that have gone through trauma, as well as it could be even short-term support, like a couple of weeks until they're transferred to the appropriate level of care.
And in your sessions with patients, is there a minimum or a maximum time limit?
Typically, our program would go from birth to postpartum up to 2 years. If it did go a little bit over 2 years because of lack of connection to care, then it would go a little beyond that, but typically it's 2 years.
Okay, and that's the duration of your treatment or your interaction with patients. But what about in each appointment that you have? Is there a minimum or maximum time set by the clinic of when you see a patient in a particular visit?
Yes. So do you mean as far as like weekly or like hour, half an hour?
Well, I guess the question is, if a patient's coming into you because they were referred and you're meeting with them on a regular basis, how long are the appointments in duration? An hour, half an hour?
So appointments could be anywhere from a half an hour to an hour based on the patient need at that time.
And when you're interacting with a patient and you're making all those assessments, are there tools available to you if you feel or you experience that a patient needs a higher level of care or is heading or is in some sort of crisis? What tools are available to you for that?
So tools that are available to me is connection to my direct supervisor, as well as crisis coordination, as well as like the crisis support numbers that are in that area. So I could either call with the patient or sit with the family, create a safety plan, and the patient can call later on if they feel like they're safe to go home and they have supports at home.
Okay. And at some points, could it be that you would need to involve authorities like the police?
Yes.
And you also are familiar with the Section 12?
Yes.
And then it's an involuntary procedure where the court gets involved?
Yes.
Now, as far as when you do meet with patients on that regular basis, either for a follow-up or an intake, is it a telehealth situation, an in-person situation?
It depends on what the patient is comfortable with and what the patient is able to do as far as like access. So we offer both in-person and virtual appointments.
Okay. As far as when you first meet with a patient, when they've been referred to you, that first intake procedure, is there a recommendation for whether that be in-person or telehealth?
All the perinatal behavioral health appointments for mental health counseling are in person, that initial visit.
And then the subsequent appointments are oftentimes directed by the patient?
Correct.
Would there be instances where you would insist or prefer that the patient actually come in person if they've elected for telehealth?
Typically, you prefer someone to come in person because they have either like fallen out of care or there are concerns for their safety for some reason.
Okay. And if you don't have those immediate concerns and it's the preference of the patient, do you often engage via telehealth?
Yes.
I'm going to draw your attention to a particular patient by the name of Lindsay Clancy. Do you remember when your first contact was with her?
I remember it was around late November, early December.
Okay. And you're aware that she came to the perinatal clinic and was being initially treated by Julie Paul?
Yes.
And by the time you engaged with her, she had her care had been transferred to Rebecca Gelada, correct?
Yes.
So fair to say you had the most contact with Rebecca Gelada about this particular patient?
Yes.
And if I mention December 2nd, does that sound familiar as the first intake with Lindsay Clancy?
Yes, as I said, around late November, early December, so that sounds about right.
Okay. And the intake appointment, was it in person with Lindsay Clancy?
Yes, it was in person.
And what were the services that were being offered for her? Why was she referred to you?
So she was referred to me for postpartum anxiety and depression symptoms. That's what she was referred for.
Okay. And in this first intake, did you go through that psychosocial history with Lindsay Clancy?
Yes.
And did you have some previous information from an intake with with Julie Paul, or did you do it fresh on your own?
Fresh on my own.
Okay. And so again, this is information that the patient is reporting to you about their history.
Yes.
And so in this instance, you noted that the defendant told you, or Lindsay Clancy told you that she had some prior contact with mental health, right?
Yes.
That she had engaged with a psychiatrist in nursing school, and that she had been prescribed medication at that point, correct?
Yes.
And that she, prior to coming to the clinic, that she had been engaged with a psychiatrist.
Yes.
Did she identify what her concerns were, or what her presenting concerns were to you?
Yes, she did.
And what were the concerns?
Her presenting concerns were anxiety, lack of sleep, depression symptoms, frequent passive suicidal ideation, thoughts of wanting to die and no longer be here.
Okay. And had she reported to you that she had been on a number of different medications?
Yes.
And you're aware that those medications were being managed by the nurse practitioners in the clinic?
Yes.
And as far as your role as a social worker, do you often kind of get into the weeds with patients about their medication?
So I'm not a social worker. I'm a mental health counselor.
I'm sorry.
Yeah, no problem. But I typically have an overview of medications, but I don't particularly get into prescribing or how to take medications.
Okay. And so what's the focus of your role in offering counseling services to women with postpartum anxiety and depression at the
Yes.
clinic?
So my role would be to create a treatment plan to address the concerns, which would be like the anxiety and depression symptoms, and work on coping skills and building community supports around that. Or if she needed a referral to a higher level of care, I would do that.
And do you come to your own conclusions as far as diagnosis goes based on your interaction with the patient?
Yes.
And in this first interaction with Ms. Clancy, you got her history. You also did some of those assessments, correct? Mm-hmm. And so as far as assessing her present condition, kind of how she presented to you, did you make observations of her mood?
Yes.
And do you recall her mood being low, that she felt numb and unable to laugh?
I apologize. If it's medical record, I don't have any objection, but I'd prefer not the leading. I have no problem if she reads from the record, though.
All right. If you could just, there's objection, in fact, leading question sustained, but is there any, so there's no objection if this witness, if you want to look at your notes, I don't know if you have your notes with you.
Do they have a copy? I think
I don't know if the parties have a copy that she could look at.
I do. I could.
Do you have a blank copy?
Well, I mean, it has like a date on it. It doesn't have a lot of notes on it. It just has a name.
I can approach page by page.
Right,
It's fine.
sure, that's fine. So if you need or want to look at the rec, just let us know. We'll do that.
Sure thing. Thank you.
Let's go. going to show you that page.
Sure.
I can speak that with her present.
Sure, yeah.
So, Ms. Dukes, on this particular visit on 12/2, what was her mood?
So she reported having low mood and feeling numb.
Okay. And so you said she reported. So in the note that you're reviewing, these particular questions or these observations that you noted, are they based on her reports to you about these areas?
Yes, and as well as my observation of her.
Okay. So did it appear that her mood was consistent with what she was reporting to you based on your observations?
She appeared to have, if you can say, like normal mood. There was no like tears or sadness, or like there was no blunted interaction. She was able to make eye contact.
Okay. And kind of moving to what's identified in your record as mental status exam.
Yes.
What is a mental status exam?
So a mental status exam is an exam that's assessing how the patient is appearing, what she is reporting, as well as any concerns about safety, which would be any suicidal ideation, homicidal ideation, as well as any intrusive thoughts or worry, any hallucinations or delusions.
Okay. And so in this exam, is it a mixture of what the patient tells you and what you're observing?
Correct.
Okay. And if I can approach you with another page, page 53.
Thank you.
In regards to, on this particular first encounter on December 2nd, when it comes to the mental status exam, were you able to observe her facial expressions?
Yes.
And what were your observations of her facial expressions?
She was cheerful when discussing her anxiety symptoms.
Okay. And did you also ask those questions about thought content? You just have to answer out loud.
Yes.
Okay. And so what did she say about thought content?
So thought content, worry about her infant and that she had an addiction to Ativan.
And you said you also, in this assessment, assessed suicidal thoughts, correct?
Correct.
And so did you ask her anything more about those passive thoughts that you indicated she reported?
Yes, and what she reported as far as like passive thoughts were thoughts of not wanting to be here or no longer wanting to live, but no plan.
And is that significant to you, the fact that she identified there was no plan?
Yes.
And why is it significant?
Because if she identified that she in fact had a plan, then that would escalate me to see it as a crisis and request higher level of support at that time.
As far as your observations of her thought process, were those within normal limits?
Yes.
And her intellectual functioning, were those within normal limits?
Yes.
Did she report to you any past attempts to harm herself or others?
No.
Did you go through with her her behavioral health history?
Yes.
And other than what you indicated as the anxiety and sleep, did she identify any concerns around substance abuse issues?
So she did identify concerns about, not in her history, but in that visit, about misuse of Ativan.
And if somebody expresses concern about that substance use, do you have a tool available to you to assess whether they have substance use issues?
Yes, so there is an assessment within the initial intake appointment that has a specific section to further assess substance use disorder.
Okay. And did you identify whether she presented with any substance use disorder issues?
I did assess that she did not present with any substance use disorder issues.
And as far as her expressed concern to you, fair to say it was focused on the one particular medication, the medication Ativan, correct?
Yes.
And why did you not find that to be an issue based on your assessment?
Based on my assessment and how she stated she was supposed to be using it, it was used correctly to remedy the anxiety symptoms.
Okay. And after this initial intake, I guess the first question is approximately how long is this initial intake appointment?
The initial intake appointment is typically an hour.
And after having spent the hour, gone through these assessments, spoken to her about her history, were you able to come up with or give an opinion about diagnosis?
Yes.
And based on her presentation to you, what was your opinion about diagnosis?
At the time, my opinion about her diagnosis was postpartum anxiety because she had a lot of anxiety about most things.
Okay. And so what were your recommendations as far as a treatment plan for her?
My recommendations at that visit was outpatient therapy, continued medication, and weekly visits with me.
Okay. And why did you recommend outpatient therapy on top of therapy with you?
So outpatient therapy was kind of like a blanket therapy, but more so like intensive outpatient therapy, partial hospitalization therapy.
And was your role in offering her weekly sessions an attempt to kind of bridge services and make sure she was getting everything she needed, or something different?
To bridge services.
And so after that meeting with the recommendation for weekly visits, did you begin to schedule additional visits with her?
Yes.
And after that particular visit on December 12th, did you send her any particular information?
Yes.
And how do you do that? How do you send patients information if you're not able to give it to them?
I can send it through my chart messaging.
And on this particular day, after your meeting with her, you sent her some resources about cognitive behavioral therapy, did you not?
Yes.
Your next contact with her was December 5th. Why December 5th, if you had just met with her on the 2nd?
That may have been the soonest available appointment that week for her.
Okay. And it was shy of the 1 week, right? Mm-hmm. Was there anything in your meeting with her on the 2nd that made it necessary to have a shorter appointment?
No.
This next contact on the 5th, was that in person or telehealth?
Telehealth.
And on this day, on the 5th, when you met with her, did she report some additional information or report how things had gone over the weekend to you?
May I see my notes?
Sure. If it's okay, I'm just going to give her all the pages from that note.
That's fine.
Thank you. Yep.
Thank you.
Okay. I'm just reviewing the note.
Sure. Take your time.
And can you repeat the question?
Sure. In that visit on December 5th, did she indicate to you or did she report to you how the weekend went for her?
Yes, she did.
And what did she say about the weekend?
She reported that over the weekend she had a difficult weekend, having intrusive thoughts about wanting to die, and that she had contacted Aspire Crisis Support. She met with the clinician virtually and was told that she did not meet the criteria for inpatient treatment due to having no SI plan, suicidal ideation plan.
And so when she reported the intrusive thoughts and having a tough weekend, did you follow up with her and begin to kind of talk with her about that?
Yes.
And what did she tell you about what she was feeling in those intrusive thoughts?
So in those times, what she reported was that it was continuous intrusive thoughts of not wanting to be there, but no plan.
Okay.
Kind of like the same report that she gave to crisis.
Okay. And as far as kind of the difficulty of the weekend and how she was feeling, did she tell you how she was feeling?
No.
In that particular meeting, when she had talked about wanting to die or not wanting to be there anymore, did you kind of follow up with her about those statements and whether she had any sort of intent or plan?
Yes.
And did you ask her additional information and complete that full mental status exam?
Yes.
On that meeting? And were there any signs of psychosis or signs of mania or homicidal ideation?
No.
And at the time that you met with her on the 5th, was she currently having those thoughts about wanting to die? If you know?
Just reviewing the notes.
Sure.
In that visit, she had no suicidal ideation.
Okay. And on this particular visit on the 5th, via telehealth, did somebody else participate in the visit as well? I could direct you to page 45.
45?
Yeah.
Okay. Yes, her husband joined the visit.
And this visit, approximately how long was it, if you recall?
This visit was approximately 30 minutes.
Okay. And fair to say, focus of the visit was to kind of deal with that bad weekend and calling
Yes.
the crisis center.
Yes.
So what did you offer her as far as recommendations or assessments or assistance during this meeting?
So support during this meeting, I offered her support in connecting to, it seemed like she needed a higher level of care, so intensive outpatient therapy, partial hospitalization therapy, as well as we reviewed, one of her main concerns was also issues with sleeping, so we reviewed sleep hygiene and how to support better sleep to see if that would help with some of the intrusive thoughts.
Okay. And as far as the recommendation for intensive outpatient or partial hospitalization, did she want to connect with those programs at that time?
At that time, she didn't decline services, but she was interested in the information.
Okay. And so did you agree to send her some information?
At that time, I did not agree to send her information.
Okay. Did she ask for any other information in that meeting?
She did ask for information and support connecting to psychological testing.
And is that something that you do at your clinic, do psychological testing?
Yes.
Okay. And so did you make a referral for her to see somebody else in the clinic, or did you provide her other information?
So I discussed this information with the provider at the time, which was the psychiatrist and medication provider at the time.
And would that have been Rebecca Gelada?
Yes.
And so did you subsequently send Lindsay Clancy some information about psychological testing?
Yes.
But there was no recommendation for it to be done at the clinic?
No.
Do you know why?
At the time, it sounded like she wanted extra support or like outside opinion as far as like diagnosis and medication.
Okay. And was the testing something that she brought up, or did it come out naturally in your conversations with her?
That's something she brought up.
In your meetings, did she did she discuss medication side effects with you?
Yes.
Okay. And what were your observations of her demeanor during this visit on the 5th?
On the 5th, one second. Her presentation overall was within normal limits. She didn't appear like anxious or different than any other visit I had with her.
And this is kind of your second meeting with her, right?
Yes.
And how many meetings did you have overall with her during the time she was at the clinic, if you know?
4.
So, but you had spent an hour with her on that intake where there's a lot of information exchange, right?
Yes.
So was there anything different about how she presented, how she spoke to you or answered questions during this follow-up on the 5th?
No.
And as far as the conversations about the bad weekend and calling crisis, did you have any concern that she was in crisis?
No.
And you made those recommendations for a higher level of care, correct?
Yes.
But nothing that would have prompted you for those other interventions that you've previously described to us, right?
Right.
Did you ever in this visit see signs of mania?
No.
And is that something you look for?
Yes.
And did you ever see signs of delusions or paranoia?
No.
How about psychosis?
No.
Now, your next contact with her was December 12th, correct?
Yes.
And was that in person or telehealth, if you recall?
Telehealth.
And on the 12th, did you have further conversation with her about your previous recommendations about partial hospitalization programs?
May I review?
Yep.
Thank you. Yes, we did have further conversation about recommendations.
Okay. And did she indicate to you that she would be starting a program soon?
Yes, she indicated that she would be starting a partial hospitalization program in Norwell on December 20th, 2022.
Did she provide you any details about that program? Do you know?
No, just that she would be starting a program in Norwell.
Was that, had you referred her to any programs in Norwell?
No.
And in this meeting with her, did you continue to talk about her need for higher level of care?
Yes.
And did you make recommendations on a different program?
Let me look. Yes, I did make a recommendation on women and infants.
And why did you recommend women and infants, or why were you recommending this higher level of care?
I was recommending this higher level of care because of continued passive suicidal ideation, even with crisis intervention, as well as women and infants was more so for postpartum women, and the infant would be able to come to the program with her.
And so the program at Women and Infants is something that you're familiar with working through your clinic, correct?
Yes.
And you often make referrals over there?
Yes.
Do you require the patient's consent to make a referral?
Yes.
Did Lindsay Clancy consent to the referral at that time?
Yes.
And so did you work to make that referral after that visit?
Yes.
Now, you mentioned that she had continued passive suicidal ideation. In this meeting that you had with her, did you assess that? Her suicidal ideation?
In this visit particularly, did she have passive suicidal ideation?
Well, do you ask if they still have that?
Yes.
Or if they currently have thoughts of suicide?
Yes.
And in this instance, did she have thoughts of suicide or wanting to die?
Just reviewing. Hold on. So yes, she reported like continued suicidal ideation at
Okay.
the time.
But did she ever indicate a plan?
No.
Having met with her on the 12th, did she ever articulate to you that she had made any attempts?
No.
And in your conversation with her on the 12th, were you able to identify any protective factors based on everything that you knew about her at this time? Now, this is your third time with her, right?
Yes.
So what were you able to identify as protective factors for this particular patient?
At this time, she had supports, which were her husband and her mother-in-law. At this time, she was able to, from the past visit I had with her, able to contact crisis when she felt like she needed extra support. So she was able to follow through with suggestions that I had given her in the previous visit.
Okay. And based on your visit with her on the 12th, she accepted a willingness to go to one of those programs, right?
Yes.
Or at least be referred.
Yes.
So was there anything about your interaction with her on December 12th that warranted any of those higher levels of intervention from you?
No.
Now, the next time you met with her was on December 19th, correct?
Yes.
And was that the final time that you met with her?
Yes.
On that day of December 19th, was that in person or a telehealth?
May I review the note?
Sure.
Thank you. That visit was virtual. And what was the question?
That was the question.
Okay.
Thank you. So on this particular visit on the December 19th, did she report any further issues or anything that had happened between the 12th and the 19th that were of concern?
So she was continuing to have low mood and numbness. She did not have any SI and had no need for crisis intervention over that weekend.
Okay. And did she indicate to you that she had been doing things at home to try to help with her mood?
Yes.
And what was she doing?
Let's see. She was spending time with family, and her children, and exercising.
Now, at this point, as the December 19th rolled around, had you already put in that referral to women and infants?
Yes.
And did you know if she engaged with women and infants by that point?
By that point, women and infants had reached out to her, but she had missed the call, but said she would contact them back.
Okay. Now, one of the concerns that you often talked about in your meetings with her was sleep, right?
Yes.
And in this meeting with her on December 19th, did she report any improvements in her sleep?
No.
Well, if I direct your attention to page 13 at the top of the page where it says risk assessment, there's a category for neurovegetative disturbances. Do you see that?
Yes.
Can you show me what you mean by page 13?
Oh.
What does it say 13?
I'm looking at prior ones. I don't know, those don't have page numbers, but the one I gave her has 13. It's December 19th. That's
Okay.
the last page of her notes.
It's this one here, then, right?
Yeah?
Okay.
There
Okay.
should be 3 pages. What did you note under neurovegetative disturbances?
I reported that sleep has improved.
And that would be information that's reported to you, correct?
Yes.
You can't make observations of whether somebody's sleep has improved, can you?
No.
Okay. So in this instance, she told you she was going to follow up with the referral, that she was waiting for a call back, that she had improved sleep, but that her mood kind of had remained the same, low mood, numbness, right?
Yes.
Okay. Anything about your interaction with her that day that was different from the prior interactions?
That day, she seemed to be more engaged. She was able to smile. She was able to laugh. And she was enjoying time with family.
And so did you look at that as something positive?
Yes.
Was there anything about your interaction with her on this day, on December 19th, that made you think that you needed to invoke a higher level of care?
No.
As far as in-person visits, did you have any other in-person visits with Lindsay Clancy after the 19th?
No.
Fair to say your contact with her was very limited after that point?
Yes.
And on December 27th, did you have some interaction with her and her husband?
Yes.
And why did you have interaction with them?
May I see the note?
Sure. It's four. Oh, no.
Thank you.
Thank you. Can you repeat the question?
On December 27th, why did you have contact with her? Why did you make contact with Lindsay?
I was calling her to inform her that her referral had been completed.
Okay. And so you had a call with her at 10:23, 10:17, going back 9:44. Do you see that in the records that you have, the 4 notes that you have in front of you? They kind of go in reverse order.
Yes.
But prior to the contact about the referral being completed and just reaching out to her and letting her know, did you have a conversation with her husband?
Yes.
And was that at Lindsay's request? Did she give consent for that?
She did give consent for that.
Okay. And fair to say he was reporting concerns of prescriptions, right?
Yes.
And that's not your area in the clinic, is it?
No.
So did you refer him to the prescriber?
At this time, yes, I redirected him to speak to the prescriber.
Okay. And again, in each and every encounter that you've had, did you further recommend that she engage with a higher level of care, either a partial hospitalization program or an outpatient program?
Yes.
Now, at any point that you were interacting with her between December 2nd and the last contact with December 27th, albeit limited, did you ever have any concerns about her physical well-being?
No.
Did you ever have any concerns about the physical well-being of others in her presence?
No.
Did you ever see or observe any signs of mania, delusion, or paranoia?
No.
Any signs of psychosis observed by you?
No.
Did you ever have any difficulty understanding what she was saying or notice any differences in her speech patterns?
No.
Did you ever have any concerns that she wasn't accurately reporting things to you?
No.
And did you ever feel the need to collaborate with your provider for a higher level of care or an additional intervention?
When I did, yes.
And so would that be for the calling the police, Section 12 or safety?
Hold on. Go ahead. We'll ask that and then we'll.
My question was, in any of the times that you engaged with her, did you ever engage with your provider to come up with a plan for safety planning, Section 12, or any other of those interventions you discussed before?
No safety or Section 12, no.
So as far as recommendations, would you agree that those were the recommendations for higher level of care?
Yes, for IOP or PHP services.
Okay. And on that last visit that you had with her, she reported doing things outside of the home, right?
Yes.
And that stood out to you
Yes.
as what?
As an improvement in mood and ability to connect with others.
Thank you. If I may have a moment to put these back together.
Why don't we take the delayed morning break at this point? So hopefully it'll be a little bit shorter than normal, but we'll get you, you can stretch your legs. We'll have you back here in a couple of minutes. Okay?
Court, all rise, please. Jurors, close your notebooks. Next question.
I can see what you were referring to.
Yeah. I just have to put them back together because they're a little out of order.
Why don't we sit down? Why don't you leave those notes? Okay. So we'll be in a short recess at this time. Thank you.
Thank you.